The number of knee and hip replacements is rapidly rising. The number of total knee replacements in 2000 was just over 282,000. In 2010, that number jumped to more than 658,000. The number of total hip replacements in 2000 was about 165,000. And in 2010, the number was nearly 303,000. The specialist at Florida Hospital Waterman's Joint Replacement Center explained the advances in the procedures which are easing the fears of those in need of surgery and likely leading to an increase in the number of those electing for surgery.
Certainly the way we do surgery now has changed significantly in the past few years. We perform a lot of minimally invasive surgery where we're not splitting or cutting muscle, which enables a much faster recovery. The incisions are a lot smaller on a lot of our total joints. That enables the patient to recover a lot quicker. Let's take a look at a knee replacement. Most patients are up the same day of their surgery and they're walking with a walker. They're usually home in about 3 days and they're pretty mobile with a walker. We switch them to a cane in about 2 to 3 weeks, and by about 6 weeks they're doing pretty well. Usually return to sports is about 3 months, but in 6 weeks if they're doing a sedentary job, I'd return them to work.
Hip replacements are evolving. The techniques are evolving, the materials that we use are evolving. We do an awful lot of hip replacements here. Of course, you have tendon sparing hip replacement, ceramic, all those things are readily done, easily done, commonly done here at this institution.
There's a new technology that I've been using recently called Shape Match or Custom Fit Knee, which is basically we get an MRI or a CT scan of the patient's leg. The MRI is then sent back to the company and they build custom cutting blocks based on that patient's specific anatomy. So that enables them to get a perfect fit on the knee implant, and it also makes it more efficient for the surgeon and the operating staff as well, because we don't have a whole bunch of instruments in different sizes. We know exactly what we're going to put in even before the patient's on the operating table. There's no guesswork on the surgeon's part in order to make the implant fit. Most people that are undergoing or want to undergo a joint replacement want to restore their quality of life. They want to be able to function again. Most of these patients that we take care of are very active, like you mentioned earlier. They want to go back to playing softball or tennis or pickleball, and we certainly allow them to do that.
The surgeons note that an improved love life should not be the reason for such surgery, but simply an added potential benefit. You'll find links to contact information for Florida Hospital Waterman's Joint Replacement Center when you click the Surgical Advances story icon on yourhometownhealth.com.